Is home, obviously, to a lot of little pests we especially see in the summertime, from mosquitoes to scorpions. And knowing these bites and stings impact you can maybe help you ease the pain a little bit. Lena DeFlorius is in Scottsdale, right where all the mosquitoes would be. Good morning.
Yeah, good morning. Thanks for sending me here where all the mosquitoes are. And I can tell you that they love me, Scott. It must be because I'm so sweet, right? So Dr. Janice Johnston, I don't know the difference between these bugs and how to get them off of me, but you do. Because not only do you study them, they love you as well.
Yes, they sure do.
So how do we know the difference between, because we're always coming inside and we have bumps all over the place. So how do we know which ones are serious or which ones are just annoying?
Yeah, well, most of the time people just get a small little bump. It might itch a little bit, but when it starts to become more serious, you might get welts, you might get hives. A lot of time it might even progress to a more serious type of reaction where people get a little short of breath, their heart might race, those kinds of things, and that's a more serious type of reaction.
So wait, how do we know that it's time to suck it up and say, you know what, I actually do need to see a doctor? It's not just, put some lotion on it.
Right. Well, when you're starting to feel more systemic symptoms that are kind of all through your body, that's an absolute sign that you need to reach out and ask for help. If you're seeing any kind of signs of infection as well too, so if it's really red and pussy, you might be running a fever, that's also a time when you want to reach out for help.
Okay, and could that be an allergy, or does that mean like you've been poisoned in some kind of way?
Most of the time it's going to be an allergic reaction that people are having, and it can happen because your body has developed a reaction to it. It could also happen because of the number of bites that you may have sustained as well too. So, one bee sting, it's annoying most of the time, but if you got stung by multiple bees, then your body might have more of a reaction to that.
And then tell me about these sprays, because we lotion up with this stuff, we spray ourselves all day long. Does that work?
Well, for most of the time, yes, it's going to help to repel them. Is it going to keep it away from you 100%? Probably not.
Don't say that to me, doctor.
Yeah, but it's absolutely going to help to repel them.
And what about kids? Is it okay to use bug spray on kids?
We never want to use any kind of chemicals on children, especially under 1 year of age. We say that for sunscreen as well too. But covering them up and keep them out of the way, that's probably the best way for the real little wee ones.
Okay, yeah, they have those strollers with the great mesh around it, so you're kind of in your own mosquito bedding.
Yeah, I wish I had one of those on most of the time.
You're telling me. I thank them very much for putting us out in the by the water.
Yeah.
Okay, so then. How do we know the difference between if it's a spider bite or a mosquito bite, or does it matter?
Well, oftentimes with a spider bite, you can actually see two little fang marks that are in there. But sometimes it is kind of hard to tell. So if you've just developed a little red bump, you might not be able to tell.
Okay, so maybe just an eye roll until it goes away, right?
Yeah.
Okay.
Well, there are some serious spiders out here too. So what everybody really worries about is the brown recluse and the black widow spider.
But you say you see very few of those.
We do see very, very few. In my career, I've probably only seen 2 brown recluse bites, but they can be very serious.
Okay, thank you so much. All right, so I guess just spritz yourself and hope for the best, guys. Back to you.